So I want to quickly look at the femoral artery, and this is a clinical importance. So clinical importance is more of like the reasons why we actually learn the anatomy of this artery. Okay, so first, it's good to actually identify where the femoral artery is. So you can see that what? Okay, you can see the deep one here, but you know it's still the main femoral artery, and vein should be here. So the vein is in blue, the artery is in red. So they usually go side by side. Okay. So the clinical importance is basically it lies just below the inguinal ligament in the femoral triangle. So it's a major site for palpating arterial pulse in the lower limb. You know, especially when you're talking about distal pulses, you know, those popliteal pulse, dorsalis pedis pulse, the rest of it. Okay, so they help you to see how the blood supply is still being maintained. So clinical uses as an access site, it can be used for cardiac catheterization. You can put a catheter right in this femoral artery up to the heart. Okay, then arteriography of the lower limb, endovascular procedures, and is preferred when the radial and the brachial sites for accessing has actually failed. Okay, so this is pulse, taking a pulse. So trauma risk is actually superficial, so it's vulnerable to all those injuries. Understand? So injuries can also cause life-threatening hemorrhage because of its large size and high pressure blood flow. So surgical relevance is a landmark in surgery. So if you want to do any surgeries around the stomach or pelvis, you have to actually identify it aside. So graft 2 is used in femoral popliteal bypass or peripheral artery disease. Okay, you can also access it under hemodialysis, then also femoral endarterectomy. So surgeons must actually be cautious of how close it is to the femoral vein, so you don't want to injure both blood vessels.